Welcome to today's crucial discussion on financial inequities experienced by women. As the world continues to strive for equality, it's important and it's an imperative that we continue to shed light on the persistent disparities that uniquely hinder women's experiences in their path to financial health. According to findings in the Financial Health Network's Gender Gap Study, only 1 in 5 women are financially healthy, and they're also more likely to be financially vulnerable than men, meaning they struggle in nearly all areas of their financial lives. In fact, women report worse outcomes on all measures of financial health: spending, saving, borrowing, and planning. Today, we'll delve into the systemic challenges and explore actionable solutions that can drive meaningful change and pave the way towards a future where financial health can be achieved for all women at every age. And I am pleased to introduce our distinguished panelists. Beth Wood is Executive Vice President and Chief Marketing Officer with Principal Financial Group, a global financial services company committed to helping people and businesses access the financial resources they need to feel more financially secure. Beth and her team are accountable for aligning the global organization around the customer, utilizing data insights, analytics, and technology to deliver compelling customer experiences and outcomes. In her role, Beth also serves as the chair of the company's Sustainability Task Force and chair of the Principal Foundation. Luz Urrutia is CEO of Accion Opportunity Fund, the nation's leading nonprofit CDFI, providing small businesses with access to capital, coaching, and support networks. Luz is a recognized financial services pioneer and executive with a track record of leading change, bringing new solutions to market, investing in the future of underinvested consumers and small businesses, raising capital, and driving scale. Her career has been focused on financial services and supporting under-resourced communities across the country, from unbanked, underbanked immigrants to small business owners. And last but not least, Rebecca Cokley joined the Ford Foundation in 2021 as the first U.S. Disability Rights Program Officer. Prior to Ford, she co-founded the Disability Justice Initiative at American Progress. A 3-time appointee for President Obama, Rebecca served as the U.S. Department of Education, Health and Human Services, and the White House, where she oversaw DEI. So you can see we have a powerhouse panel of very dynamic women. So we're going to figure this out in the next 30 minutes, right?
That's right.
So let's talk about financial inclusion and empowerment. We know that women, particularly over the age of 50, are leading the way through their paid work, unpaid caregiving, and purchasing power, both domestically and globally. Why is it important for society to address this gender gap in financial health and invest in women's financial well-being? And Luz, we'll start with you.
So good morning, everybody. Glad to be here. So I'm gonna start by talking from the perspective of women as entrepreneurs and how they are fueling growth in small businesses across the country, and unfortunately facing significant barriers to thriving and to succeeding. You know, in the past 5 years, women have been at the forefront of new business formation, doubling the growth rate compared to businesses owned by men. And their economic impact has been terrific. 40% of small businesses are owned by women. They employ nearly 12 million people, and they generate nearly $3 trillion in business revenues. But remarkably, 90% of women entrepreneurs are self-employed, and they run their businesses solo. And while the drive for a better financial future is what drives over 60% of new business owners, for women, it's different. Their priorities are about flexibility and a social pursuit for community goals, community-centered goals. And while women are represented in a number of fields and sectors, 25% of small businesses that women own are focused on healthcare, on social assistance services, and personal care, which are providing critical community services. So think about childcare, home care, mental health support, right? But unfortunately, small businesses in this field have very, very slim profit margins, right? And that's kind of, at odds when they are providing such critical services to the communities. If you look at a survey that was recently done by Wells Fargo, 2024, Impact of Women-Owned Businesses, it shows that if women had the ability to generate the same type of economic impact and output that men-owned businesses generate, we would be inserting over $8 trillion into the economy, which would bring increased generational wealth opportunities and much more long-term financial health. So, it is imperative, right, that we look at women entrepreneurs and women in general, and that we all make a conscientious effort to invest in the resources that they need so that they can grow, thrive, and succeed and build healthy communities.
Thanks. Beth?
Yeah, listen, I'm going to take a little different tact. Thank you for that. I just learned a lot. These are incredible women that have done incredible things in their respective careers, but that also live for the passion of helping women break out of the barriers that we face every single day. There are so many systemic challenges that we face, but look at all the areas where women are emerging. And one of the areas that I think is really fascinating is loud budgeting. Women need to be talking about money. We need to be talking about money with each other, with our spouse, and we need to be looking out for ourselves. We've broken so many glass ceilings over the years. This is another glass ceiling that we need to continue to break. We are focused on helping women do that by providing financial education, by ensuring that there's access to credit, to debt, to financial tools, to advice and guidance. How many women in this room, sorry men in the room, but how many women in this room feel you don't deserve a financial advisor? Hopefully no hands go up. Every single one of us deserves financial advice and guidance, but we need to go out and seek it. We also need to look out for ourselves with our own accounts, our own retirement plans, and our own emergency savings. So this is yet another seminal moment for women to take advantage of having a voice. And I'll steal a line from Sally Krawchuk. She often says, many of you know Sally, she often says, nothing bad happens when women have more money. Right? Gotta love that in her. Yes, it's great. It's great. So be a little selfish. We are not selfish as a gender. We tend to give. We give through childcare, parent care, through our workplace. And there are so many stats, I won't quote them all, but there are a ton of stats that talk about women and our empathetic and philanthropic view of the world. We need to be a little selfish here. We all need to have an emergency fund. We need retirement plans in our own name. That doesn't mean you're not going to tell your spouse about it or your partner about it. You absolutely need to talk about it, but you also need to look out for yourself. So we're an advocate for that. We're also an advocate for female and diverse-owned small businesses. This is another area where women can control their future. So we're really excited about what's happening. We know that to really get to gender equality is probably another 300 years, just not acceptable.
And Rebecca, as we look at the systemic challenges and the discrimination that's really impeding women in their financial wealth and health, how do societal norms and expectations regarding gender roles contribute to this disparities in financial health between men and women? And what does that look like for older women, for Black women, for women with disabilities, and other marginalized communities?
I was actually going to build on what my colleague just said about how nothing bad happens when women have more money, unless you're disabled, because then they'll take your health insurance away. I think it's important to note that while the Fair Labor Standards Act did so many phenomenal things, see, capitalism doesn't like when I talk about this stuff. The Fair Labor Standards Act did so many amazing things for the American workforce. It also legalized paying disabled workers as little as $2.15 a week. While we have great opportunities for entrepreneurship, disabled people are left out because most minority-owned small business loan programs don't consider disability a marginalized population, even though, as you just heard, it's legal to pay us $2.15 a week. We can't have more than $2,000 in a bank account, or we lose our health insurance in many cases. We're the most likely to be both recipients of care, but also providers of care for our aging parents. and aging loved ones. And I think we know disproportionately it impacts women of color at even higher rates. And so there is this connection, it's this sort of Ouroboros around the nexus of poverty and disability, that until we get at that, disabled women are never able to have money. As it stands even right now, Medicaid has a civil asset forfeiture policy, which means if Medicaid dollars, if you've had to tap into Medicaid dollars to be able to maintain your home, to be able to maintain caregivers for your loved ones, you don't get generational wealth. Because as soon as you die, the government comes and takes your house, takes your estate. And so, you know, in my community, we don't have those same opportunities that non-disabled women have. We also know that women are disproportionately likely to be disabled because of the amount of care work that we tend to do, and care work tends to result in repetitive stress injuries and trauma and depression and PTSD. When we look at the latest data on the disability population, the highest growing number is women of color with long COVID, who we also know are having a much harder time getting formal diagnoses and getting the supports and services they need because the supports and services aren't out there, aren't culturally relevant, are also intrinsically, fundamentally grounded in white supremacy and capitalist racist structures. And so when you think about the fact that we have 20 million newly disabled people post-COVID that are going to fall into all of these traps that require by law that you have to be poor, because we seem to think that that's okay in this country, we're actually going to need to do a lot of a deeper dive and deconstructing a lot of these harmful policies.
Great. I want to make sure everybody.
We're screwed. Sure, clap on that.
Well, I want to build on what you were talking about with caregiving, and really how this is impacting women. So can you talk a little bit about that more, and then maybe Beth, from your perspective as well?
Absolutely. We know that the care economy is one of the fastest parts of our economy. Yet we have seen multiple attempts to financially invest in it by the federal government all fail. In the disability community, we lovingly refer to it as our favorite drinking game. We're like, oh, they're looking at home and community-based services again. Let's not hold our breaths. But it is critical. And when we look at who make up the majority of care workers, it's predominantly women of color, women with limited English proficiency, women who 1/3 of which are also on some sort of federal benefit or supports and services themselves, and are doing this work to not only care for somebody in their family, but care for folks externally. The system is not working, and yet, you know, thorough examinations of the nursing home industrial complex on the other side are not delivering. I mean, when you look at sort of the aftermath of the pandemic, we actually saw during the pandemic the largest increase of employment for women with disabilities in US history, even beyond the passage of the ADA. And what did it? Two things. All of the non-disabled people in the world discovering, they Columbused something. They discovered something. Do you know what they discovered? Telework. The disability community has been asking for telework since before the passage of the Americans with Disabilities Act. And it was discovered. And we saw states that had robust telework policies saw their disability employment numbers increase by 14%. 14%. We've never seen that before. States that had Medicaid buy-in, as well, Medicaid expansion plus telework, saw those numbers go up 20%. And so what we know actually what we need to do to make it easier for folks to enter the workforce, but just like Columbus discovered the New World, supposedly, the workforce has now forgotten telework. And so we're actually seeing employment rates for disabled people, and specifically disabled women of color, go down significantly following the return to offices. You know, and as you all talk about the glass ceiling, I like to talk about the glass staircase. Because in the disability community, I like to quote our activist Stella Young, who said no amount of smiling at a set of stairs ever turned it into a ramp.
And again, building on caregiving, Beth, and also Luz, from kind of just a retirement standpoint, and also kind of from a business development standpoint, and what entrepreneurs are doing when it relates to caregiving. Can you talk about that a little bit?
Yeah, sure. I'll start and I'll turn it over to my colleague. You know, look, women entrepreneurs, I was a female entrepreneur for 12 years before I returned to corporate America. And when I ran my own business, one thing that was important to me was understanding my workforce and ensuring that the benefits and the flexible work, this is pre-COVID, the flexible work that I offered my workforce was meaningful to them. And so for small business owners and leaders in America, don't just automatically go back to, okay, 5 days a week in the office. We have found flexible work as a community because necessity is the mother of invention. Ergo, we don't say necessity is the father of invention. Let's not forget that, okay? So it is the mother of invention because women generally tend to look for ingenious solutions to systemic problems. And a systemic problem is when you have to care for young children, potentially a disabled or premature young child, and you also have to care for aging parents. Who does that fall on? 77% of the time that falls on the female in the relationship. 45% of that time that falls on the male in the relationship, and oftentimes on both. So you have to, as a small business owner, as a corporate leader, talk to your employees about what the benefits are that they need, and those benefits include flexible work. I'm a big fan of hyper-personalization when it comes to benefits. You give a bucket of money to each of your employees and an a la carte menu of benefits, and they choose the things that make the most sense for their situation. It becomes an idiosyncratic suite of benefits. People love it. Because if I don't need medical insurance, I don't want to spend your money on medical insurance. But maybe I need flexible work more than my colleagues. So just think about the world as a flexible situation, both when it comes to retirement and group benefits, and also when it comes to work arrangements. Luce?
Yeah, you know, I would say, and we saw this during the pandemic, right? Without affordable childcare or even access to childcare, women have a real hard time being able to get to work, do professional development, you know, and in some cases get their businesses going. And we personally saw this during the pandemic, where, you know, women now were faced with all these care responsibilities, and on top of it, having to monitor their children's schooling at home. And, you know, this is why when people ask, well, a lot of women businesses don't make it, well, really, you try to do 5 jobs and see how well you can make it, right? And so we saw that as being a big, big challenge. And still, as I mentioned, in the last 5 years, women-owned businesses have by far exceeded new business formation compared to men. So we can do it.
Well, and I think, if I can jump in, I think we can do it in any type of job, too. I mean, I think something that you both hit on, I'm reminded when I worked in the White House, I remember taking my son to daycare one day, and daycare was right down the street from the White House. And I was wearing a white suit, and you can imagine where this is going. I pull the kid out of the car seat, and we have a diaper explosion. Epic diaper explosion. And I used Siri to call my boss, who was down the street at the old executive office building, and I was like, all I could muster to say was like, Teresa, poop everywhere. And she was like, where are you? And I'm like, daycare. And she's like, well, you're gonna go in and pass them off because that's what you pay them for. You might give them a smile and something a little extra at the end of the month to thank them for this triage moment. She's like, you're gonna go home, you're gonna take a shower, you're gonna do whatever you need to do to feel human again. You're gonna throw your clothes in a bag and drop it off at the cleaners, and I'll see you when you get here. And she was a mom of 5, including 9-year-old twins that are autistic. And having her as a boss, even in a place as demanding and 24/7 as the first term of the President Barack Obama White House, was such a vast difference from when I had someone who was not a caregiver as the boss, and just the flexibility. And so I think a lot of times people will say, oh, you can do that over there, but not in this type of work. If you can do it in the White House, you can do it anywhere.
You know, please. I do want to build on that because I happen to have a leader who believes in 5 days a week in the office. Okay? But I give him a little bit of grace because this is what he knows works. So it is our job as colleagues and as workers to demonstrate that adult rules apply, that we can all act like adults in the workplace and manage a flexible work arrangement. We have to do that as workers and as leaders. And if we do that, we'll get out of this disruption of return to office, this disagreement about return to office, and things will just go back to the next generation of work arrangements. So I think we have to remember there is an equal accountability between leaders and workers. And I have workers who demand flexible work. I'm like, that's not the way you're going to get this. Show me how it can work, because they have much better ideas than I have. So I'm with you. And it's all about partnership.
Absolutely.
Between workers and leaders.
And what are some of the other systemic things we need to look at when we're talking about women and gender and equity and their financial health? You know, beyond the employer and the employee contract, kind of what systemically do we need to examine and confront?
Do you want to start? So I'll hit three. Number one is our own headset. We do not have the confidence, women do not have the confidence that men have. They just don't. We were not born with it. I don't blame my mother, I don't blame my grandmother. I don't have it. I'm trying to find it. So anything we can do as women to help each other, we need to do. Madeleine Albright is an incredible voice, and she says, there's a special place in hell for women that don't support other women. I had that conversation with Caitlin Clark's mother on Tuesday, because that poor girl is suffering from women around her who are not supporting her. You all know who I'm talking about, right? So number one, women need to support other women, and we as individuals need to combat that natural lack of confidence that we have. Systemically, we don't believe we have the same kind of access to retirement plans, to financial education, to financial tools. We absolutely can, but we have to take advantage of it. We have to take advantage of the things that are available to us. And then thirdly, there is this caregiving, gaps in wages, there is gaps in employment. When COVID happened, women were more likely to leave the workforce than men, and we have still not recovered from that 4 years later. That's a systemic issue we have to resolve. The issue of long COVID with specific segments of the population, we have to solve those issues. And so women in the workforce, the gaps that we take in the workforce to have children, that's something that we struggle to recover from. And so we have to take a more aggressive approach to financial advice and guidance, to setting up our own emergency funds, our own retirement accounts, and seeking the expertise and advice that we need.
You know, I look at the data, right? Because the data tells us a lot. And in 2023, if you see how much money women got from venture capital, you want to make a guess? 2%. Women of color, 1%. Commercial bank loans, 4%. So we have to hold institutions that claim that they are to support women accountable for outcomes. And it's the input, how much capital, it's the output, what do they do, right? Until we start to look at, and Jennifer talked about this yesterday, providing standards that institutions can measure themselves against to see how successful they are at the different interventions and the outcomes they are achieving, it's going to be really hard to achieve the outcomes and the results that we want.
100%.
So what are you optimistic about? How do you not, in the face of statistics like that, how do you not give up? What is it that's making you go on, and what are you seeing are the bright spots that let you know? Beyond the fact that we know that women are incredibly talented, hence why we're the mothers of invention, as you just said. But what is it?
You know, when they go low, we go high. I think it is a collective effort, right? I think it is, first and foremost, we have to understand what are the gender-specific challenges through research and data collection that are impacting the different needs of women across age, race, ethnicity, socioeconomic backgrounds. So then we can start to develop and implement policies and programs that are really outlining the barriers that women face, right? We need to ensure that there's equal access to find quality financial services and educational programs that are tailored to the specific needs of women. We need to put women in leadership roles, right? In financial institutions and policy-making bodies, so that there can be diverse representation in decision-making that brings in the perspective and needs of women. And then we need to create standards, and standards that can all be followed to make sure that the outcomes we're trying to achieve and the improvements that we're trying to make for women can be truly measured.
I want to build on that because it's such a great point. At Principal, we have an annual study called the Global Financial Inclusion Index, where we ask government systems, employers, about inclusion, and employees about inclusion and how people feel across a number of standards. And across 23 of 25 inclusion standards, there is a double-digit gap between men and women feeling less included in the financial community than men feel. We've got to solve that, and that is to your point, Luce, about starting with research and data and really understanding the nuance of how society and brands and corporations and financial providers see both genders. So we have to first and foremost start with the data. The second piece is, I agree with you 100% that women in leadership positions shifts the narrative. Disabled persons in leadership positions shifts the narrative. We need firsthand knowledge. So we have to be advancing people in all different walks of life into these leadership roles. The other thing that we know is important is that those who are later in life that have already been through the corporate world and are at the precipice of retirement can bring an incredible amount of value back to the workforce. So we're actually exploring encore opportunities, post-retirement internships. How would you like to be a 65-year-old intern in a new career, in a new function, and bring that depth of experience to the workforce that you've had maybe in another discipline? So there's a lot of opportunities. It's not just about gender equality. It's about age equality, disability equality, finding opportunities for us to close that inclusion gap.
I also think if we're going to push for people being in roles, we want to make sure that they have supportive boards and they have supportive people around them. I don't know about y'all, but I have seen way too many moments of Black women being elevated into leadership situations with the purpose of cleaning up a hot mess, and then being out in a year, like a year and a half, and everyone's like, well, see, look, Black women can't lead. And it's like, because there were no supports in place from day one to help her grow and thrive. There was no coaching. There was no pulling the board together and getting their ducks in a row and saying, like, we are not going to perpetuate what we see happen time and time again. And so I think there's a need to be really direct on that. I used to run into the confidence thing all the time when I was in the White House placing people in jobs. And so I actually started making playlists for women candidates to listen to before they went in for a job interview at a federal agency. And you could tell the women that hadn't listened to the playlist. Because I would get a call back from the agency and they were like, she was all right, she did okay. Versus the women that came in and, like, mind you, it was like totally cheesy 80s like power rock and stuff. So it was like the Top Gun sound, like tons of Kenny Loggins, you know, tons of Cameo. It was like very funk, very party driven, but you actually saw a difference in the performance of those women, particularly in the economic agencies that traditionally were more hostile to women leaders. And so I think there's a litany of ideas, but it's also about not just how do we support and transform the individual leaders, but how do we support and transform the institutions that we're putting them in, so we're not just putting people in hostile work environments expecting them to turn things around.
Thank you. So I want to thank all of you ladies for the words of wisdom that you shared with us and the sage advice and what we can do as women to lead our institutions, to demand more, to use the data, as one of my mentors used to say to me, look at the data, then use your common sense. Because we know what's in front of us and we know it needs to be solved. And as somebody who is able to be here today, because I have a family caregiver, because I have a young adult with a disability, it means the world when your employer supports the work that you do. It means the world, and you will have the most loyal employees that you will ever have. So again, thank you all for being here today. And thank you for this conversation.
Thank you, Staci.
Thank you, Staci.